Hi everybody, I'm Jordan Weber and we're going to go through a full mobility program today. So we're going to get started. We're going to start in the seated position like I am now. We don't need any equipment. I'll give you some suggestions if you need any modifications. If you're not able to perform any of these positions, I have a lot of other adapted videos, and if you can't do any of the positions or need help, comment below, and what I'll do is I'll make a video just for you. So just tell me exactly your issues or your concerns or your questions, and I'll help adapt a video made just for you. But if you can carry out this entire duration of mobility, then I encourage you to stay with me. So we're going to start seated, and then after we become seated, we're going to go ahead and just bend our knees at a 90 degrees and abduct our hips. So our hips are abducted. Okay, they're going out, like they're going outer space, abducted by aliens, whatever you want to call it. So they're abducted and the hips are flexed. Not only are the hips flexed, the knee is flexed, the ankle is flexed. So this is dorsiflexion, knee flexion, hip flexion, and also hip abduction. Okay? And what I'm doing here, when I'm abducting my hip, I have to kind of squeeze my glute to do that. So the more I bring my knees back this way, the more I have to squeeze my glutes. And the more I bring my knees this way, on the inside, I start adducting my hips, hence using my adductors. Okay, so you have your adductor muscles, you have your abductors, which are your tensor fasciae lata, your let's see, your TFL, and then you have what is called your IT band that runs down, but that's not really a thing anymore. It is for some people, it is for others. All it is just the zip, or where all the tissue kind of meets, and so a lot of people call that the IT band. It's just another reference in anatomy. So you have your iliac band, your tensorofascial lata, your glute medius, and your glute maximus, which are abducting the hips. Okay, when you're adducting the hips, what you're doing is you're going to internal rotation of the hips, and you're beginning to use the inside or adductor muscles. You have your adductor magnus, longus, maybe even brevis, I'm not even sure, probably not. But you have your gracilis, and then you have a sartorius that runs down across. So starting at the hips, and it goes on the inside all the way to the knees. So those are your adductors. So when you're internally rotating your hips, you're using your adductors, and when you're externally or going outwards, that you're using your external rotation of your hips. So internal rotation of the hips and external rotation of the hips. Okay, so go ahead and practice this with me. So we're going to straighten our feet. We're going to bring our feet out, and then we're going to externally rotate the hips, and then from here we're going to internally rotate the hips. Externally rotate, internally rotate, externally rotate, internally rotate. Now I want you to hold here. I really want you to internally rotate as much as you can. Keep those ankles flexed and keep those knees straight. Now from here, externally rotate as much as you can, trying to press the outside edges of the feet into the ground. And then as you do that, I want you to abduct and flex the hips as much as they'll go. Actively. I don't want you to pull them up. I want you to know what you can do actively. Okay? Once you get to your max point, you're going to notice that if you let go of your hands, you're just going to fall back. So one, you can put your back against the wall, or two, bring your feet out a little bit forward and bring your elbows on the inside of your knees and bring your hands together. Keep breathing here. So now we're going to focus on our breathing. You're going to inhale through your nose and exhale everything out. This whole time we're doing this, we're inhaling and exhaling consciously. You can go over breathing in many different ways. We could be going through breathing techniques and postures the entire duration, but really, essentially, you should be inhaling fully and exhaling fully. And once you get into positions where you feeling strain, then you have to either breathe through that, or you have to hold your breath at times. So sometimes you're holding your breath, and that's okay, but don't hold it to the point of pain, and don't hold it to the point of a pressure where you're exerting too much force and you're going to injure yourself. So you should never feel pain in any of these positions. So right now I want you to just bring your hands together, keep your feet open, and I want you to bring those heels forward and bring those toes back. And then from here I want you to actively flex those hips and abduct those hips even further. I want you to squeeze your hands and straighten out your elbows. From here, I want you to just actively externally rotate those hips. Hold here for 10 seconds. Just breathe. Good. From here, go ahead and bring those hands behind the back. Rest them on the ground. Now with this hip, I want you to mirror me. So you're going to use your left, I'm going to use my right. From here, I'm going to bring the knee toward the midline of the body. And I'm going to hold right here. I'm internally rotating this front knee, and I'm externally rotating the side knee. Breathe and hold. And switch. I just want you to notice what side might be tighter, what side has more range of motion, what side you have more control over. So just think about these things as you go through these exercises. So let's switch side. Let's try to get that knee all the way down. Good. All right, let's come back to our bear sit. So this is the bear sit position that we've been holding. You're going to notice that there should be a lot of stretch going on the inside of our thighs. Some of you have maybe even quit by now. So from here, what we're going to do is we're going to straighten out those legs. Okay? We're going to bring those hands behind our body. Now from here, I want you to go back to the external and internal rotation of the hips. Now this time we're going to point the toes as we external and as we internal. Good. From here, what we're going to do is we're going to tighten up our quads. Our whole lower leg is tight. Both lower legs are tight. We're going to push into the ground, and we're going to hold tense through the abdomen and lower back. From here, we're going to tense up the chest and shoulders as well. You're going to push into the ground, and as we do that, you're going to mirror me with your left leg and my right. We're going to go ahead and we're going to flex the hip up. We're going to hover up and over, forward, and then we're going to bend that knee into butterfly. Okay? So go ahead and start irradiating. Body is firm. Up, all the way up and forward. Hold here. Up as high as you'll go. And slowly bend the knee. And bring the heel toward the midline. Knee goes out. Try to bring that knee up as high as it'll go toward the shoulder. And then slowly rest the foot down. From here, other side. Point the toe. Whole body is tight. I want you to actively press this knee down. Here we go. Up. Forward. Hold here. Breathe. Bend the knee. Open up the hip. And let those feet touch each other. Try to open those feet up and try to actively press those knees toward the ground here. So we're actively pressing those knees down. Our hands are behind our body right now. Hold here. From here, we're going to slowly bring those hands out front. You're going to notice our knees are going to go up. We're going to lack the ability to stay upright. From here, squeeze those palms together, and we're going to actively press those knees down. So actively press those knees down. Actively press those knees down. Actively press those knees down. Good. From here, I want you to wrap your hands around the ankles and press the elbows into the thighs. Breathe here. Now we're going to try to adduct the hips to the midline, but as we adduct the hips, we're going to press our elbows into our thighs. So it's going to create an isometric contraction on the angle here. Okay, so we're trying to create this angle, but we're not going to let it happen. So we're going to press down. We're going to go ahead and press down and try to close the angle. Breathe and hold here. I just want you to press down for about 10% effort, so not that hard. We're going to bump it up to 20%. Make sure that your whole body is engaged. 30%, 40%, 50%. Hold here. If you're getting to any pain, if you're feeling any pain, I want you to lower it back down or straighten out your legs. If you're good, let's go to 60%, 70, 80. Really try to close those knees. If you're not feeling it in the adductors, you're not doing it correctly. I want you to use the inside of the tissue here to try to pull those knees up together. Press down with the shoulders and the hands here. Hold tight, 70%, 80, 90, 100. Hold here for your safest, greatest effort. If there's any pain, I want you to reduce. Hold here, 3 more seconds. Now from here, squeeze your hands together and actively press those knees toward the ground. Actively press those knees toward the ground. I want you to use the tissue on the outside of the leg. So you're not using your adductors, you're using the outside. Your gluteus maximus, all the outside here. I want you to squeeze those knees down. Squeeze those knees down. Squeeze them all the way down. Keep pressing down. And relax. Okay? It's going to hang out right here. You can bring your hands behind you if you'd like. Okay? From here, we're going to go from butterfly to bear sit. Bear sit to butterfly. Okay, we're going to try that with our hands behind our back first. So go ahead and try that with me. If you didn't, we're going to try it this side. Bear sit, butterfly. Okay, let's try it on the other side. So your left, my right, if you're mirroring me, or we're both using our right here. So we're going to go ahead and bring that foot up off the ground. Hold here. Go up as high as it'll go and back to bear sit. Bear sit to butterfly. All right, let's try it on the other side. Butterfly, press down with the foot that's still down. Open it up and hold here. Bear sit, up, in, butterfly. Now we're going to try that with our hands in front. Okay, squeeze the hands, start in butterfly, foot goes up and out, knee goes up toward the shoulder, outside of the foot goes down. I want you to actively press this foot and knee down. As we're in this position, I want you to press this foot and knee back. Hold here. Okay, so bear sit, butterfly, switch side, actively press this knee and foot down, actively bring the opposite side up, breathe and hold, flex the foot, open it up, bear sit. Press this foot and knee back and down. Press this foot down and this knee out. Actively hold here. Bear sit all the way to butterfly. Good. From here, go ahead and straighten those legs out. We're going to go back to the external and internal rotation. We're going to dorsiflex or flex those ankles. Good. From here, we're going to go into 90-90, all right? So we're going to face any direction you'd like. And what we're going to make sure here is that both of our knees are at 90 degrees, okay? So this knee's at 90, this knee's at 90. I'll give you all the different angles. Notice that this foot is lined up with this knee, shin, and ankle, okay? So my knee isn't like this, and my knees aren't like that. I line those up. This knee is straight in front of my belly button. My chin tries to stay over my sternum and my navel, so I'm never leaning forward or bringing my head down in flexion, okay? So notice that this knee's in front of the navel. That means I might have to open up, might go from an acute angle or a less angle to a more obtuse, or that 90-degree angle. I'm trying to find that 90-degree angle. Belly button is behind the knee. So this is your lead leg. This is your trail leg. So regardless if you're mirroring me or trying to do the same side, this is your lead leg, this is your trail leg, your front leg, your back leg. That way we don't have to say left or right. So with our lead leg, it's at 90 degrees. Both ankles are dorsiflexed, okay? Foot's in line with the knee and the back foot. My hands are kind of like kickstands on a bike, okay? You can use the wall. I can have a block or a ball here. I can be holding on to two dowels or two sticks. You could be holding on to a medicine ball or a kettlebell here. And that'll help with irradiation. That'll help with balance. So right now, if you don't have a lot of balance, what I want you to do is just press your hands. We're going to just frame this knee. So we're going to frame it. So the knee is exactly in the center of the frame. Palms are out like kickstands. Knees are at 90 degrees. This back leg, this trail leg, should be out right in front of the hip. Okay? So the hip is always in line with the knee, and the knee is always in line with the ankle. Ankle is always in line with the toe. Just making nice 90-degree angles here. Okay, that's why they call it the 90-90. Okay? So we're going to try to sit upright. Okay, upright meaning with a tall spine and a straight back. And then from here, with this lead leg, that glute, I'm trying to kind of flip up toward the sky, okay? What I'm doing is I'm doing an anterior pelvic tilt. That anterior pelvic tilt is going to help that glute go upwards. So that trail glute goes up. I'm trying to expand that glute up toward the sky. Now if you feel any nerve issue here, you might need to try to find a different position. So if this is any pain here, you can maybe bend those knees a little bit more like this. Okay, so we're in that kickstand 90-90. Back is straight. You're gonna hold here and breathe. Now when we're here, we're not just leaning into our arm and kind of just relaxing. I'm actively pressing this knee, ankle and toe, heel, outer toe, outer knee, outer hip, inside, inside. I'm really trying to press everything into the ground. I'm trying to really feel grounded here. So with that active stretch, I'm internally rotating my trail hip and I'm externally rotating my lead hip, okay? So this lead hip is in external rotation. The lead knee is in knee flexion, and the trail hip is in internal rotation. So internal rotation, external rotation, external rotation, internal rotation. Okay, so your hips internally and externally rotate. And so what we're finding in this position, since we're externally rotated, is our capability of external rotation. And in this back position of internal rotation, we are assessing our internal rotation capability. So this 90-90 mobility exercise really teaches us if our hips can externally or internally rotate. Okay. Now, if you can't sit up straight without any support, without cramping, that means that your hips aren't able to support you in this posture, which means that you either need to work on internal or external rotation. We can try to figure that out. So what we're going to do is we're going to lean on the outside onto our forearm, and what we're going to do is we're going to externally rotate that lead leg. Okay, so we're going to externally rotate it, and so the foot will come off the ground if we externally rotate it. Okay. Now, if your foot doesn't come off the ground, then you lack external rotation in that lead hip. Okay, so if this is your hip here and you can't get that foot off the ground, then you lack the capability to externally rotate that hip. Now, with your trail hip, now what we're going to do is we're going to try to internally rotate the trail hip. Now, if you try to internally rotate that trail hip, the foot should come off the ground. Now, if you can't get that foot off the ground here, then you can't internally rotate that back foot, or that back hip. Or if it begins to cramp, then you know this is something that you need to work on. Same thing here. If this begins to cramp, or if something begins to give here, that means you really need to work on this position. Really working on this position means holding this position for 1 to 2 minutes, holding here nice and tall, breathing in for 4, out for 8, or in for 5, or out for 10, and letting the let the parasympathetic nervous system take over. Let the body relax in this position before you just push into another position. You see me doing a lot of videos where I'm moving and I'm going really fast, but that's not going to help me in the long term. That's going to be something that's kind of fancy and fun to do, and honestly I like doing it because it feels really good. But if I'm trying to fix these hips, I'm not going to be going that fast through those sequences. What I'm going to do is I'm going to passively stretch this position for 2 minutes, and then I'm going to begin those contractions, your pals and rails effort. And if you don't know what that means, that's fine. All we're going to do is take this lead leg and we're going to push it into the ground using external rotation and the outside tissue of that lead leg. So that lead leg is going to press into the ground. Pretend there's a scale underneath your shin, and that scale is progressively getting higher and higher. So you're trying to create resistance or load into the ground here. So we're pushing into the ground with this whole outside leg. This trail leg is going to stay strong. I want this knee pressing into the ground. I want this ankle pressing down into the ground. My hands, I also want pressing into the ground. My body, I also want to be tense. Okay? I don't need to come all the way down and go like that. I want to try to stay in that position with my back straight and the anterior pelvic tilt. Okay, trying to get the glute up toward the sky. And as I do this, I'm going to hold this, and I'm going to progressively go up from 5 to 100% effort. And once I get to 100% effort, if I'm able to hold that effort for 10 seconds, then it's probably not high enough. So you're really trying to max out your effort. If you feel pain, just bring the tension down. So if you get to 80% and you start feeling pain, just stop. So with this front hip, we're going to begin our PALS effort. Our PALS effort, externally rotating that hip into the ground, pressing all the outer tissue into the ground. Back hip is engaged, core, everything is engaged here. Sitting up nice and tall, pressing this knee and foot and hip down into the ground, 5 to 100%, 30%, 40, 50, 60, 70, all the way to 100 to your greatest, safest effort. And then our rails effort is going to be using the opposite side of the tissue. So, yes, we're getting the external rotation here, but now we have to try to use the tissue on the opposite side of the capsule. So the capsule has so much space in and around it that you have to get both sides of the tissue to send a central nervous system response to gain that mobility that you're looking for. So that rails effort, I'm going to try to pull that knee up toward the sky and that foot up toward the sky actively. I'm pulling it up instead of pushing it down. So I'm using the tissues on the inside of the thigh and leg, pulling it up toward the sky as high as it'll go, upwards to 10 seconds, and then back down to my passive stretch. Going back to my breathing. Now for my internal rotation of my trowel hip, what I'm going to do is I'm going to actively press my knee and foot and hip into the ground. This time, what I can do is bring my hands together or straighten them out toward that trowel side. So trying to keep an upright posture here, pressing that knee down and foot down into the ground actively, keeping this side tense, knee down, hold and breathe, 5 to 100%, 10%, 15, 20, 30, 40, 50, 60, 70, 100, greatest, safest effort. So this is my progressive angular isometric load, or my PALS effort. And then I'm going to go into my rails effort. I'm going to push into the ground, and with my hands, I'm going to pull that hip up off the ground as high as it'll go. And now I'm going to press that knee down and foot up toward the sky as high as it'll go. An internal rotation as much as it'll go, and relax. Okay? Now we're going to go ahead and get our other side. So I'm going to let you just transition any way you need here. But if you want to transition correctly, this is what we'll do. So if you're in this position and you want to transition with a little bit of flow or just a little bit more active mobility, we're going to go from framing the foot and hands together, facing the center. And then what we're going to do is we're going to hinge that hip, that trail hip open. And then we're going to open up the heel and foot. And then we're going to slowly let this foot come off the ground. And as we do that, however, we want to actively press this knee down and actively press this knee back. So we're actively pressing it open and back, and then finally allow it to open up. Hold here and strong. You can do the PALS and rails effort here. What you would do is you'd hold this passively. You'd internally rotate the hips actively, 0 to 100%, and then your regressive angular isometric load would be to grab the hands and let those knees go out, going out this way. So that would be your PALS and rails effort for internal rotation. So here we have our push. This is our external rotation, PALS and rails. This is our internal rotation, PALS and rails. So there's a difference here. So when you're working on the front hip, or when you're working on the lead hip, what are you working on? External or internal rotation, PALS and rails? Guess. Okay, this is external rotation, PALS and rails. So because we're externally rotating in the external rotation position, then we are doing the PALS and rails for external rotation. Okay, so we're in internal rotation. When we're in our PALS effort, what we're doing is we're going further into internal rotation. So that's your progressive angle. When you're going back, when you're bringing that foot up, that's a regressive angle. Okay, that's your regressive angle. That's why it doesn't go that far. We're working on the end ranges of capacity in your joint capsules. So here we are in our lead leg, getting external rotation feedback into that hip capsule. And what happens is we build upon mechanoreceptors from the brain, and they sense what we're doing. And this, in essence, what it does is it sends signals to the brain and says, hey, we need to grow more here. We need more mechanoreceptors. We need to build capacity. This hip is moving in a new way. It needs to adapt. We need to adapt, send more blood, send more tissue. Let's get going. Let's fix this. Let's, something's going on here. Okay, so here we are. Our front or our lead hip is in external rotation. Our foot is in line with our knee and foot. Okay, so here we are at 90-90. Okay, our lead leg is in 90 degrees, and our trail leg is in 90-degree position. So here we are in 90-90. Our lead leg and knee is in 90 degrees. The foot is dorsiflexed. Also, the ankle should look like it's at 90 degrees. And from the hip to the knee, we're going straight out. So the belly button to the knee is going straight out. So here we are in our 90-90 position. Our lead leg is bent at 90-degree angle. Our foot is dorsiflexed and in line with our trail knee and foot. Both feet are dorsiflexed, both knees are at 90 degrees, and both knees are straight out in front of the hips. Okay? You should see two 90-degree angles. What we're going to do is we're going to face the lead leg or forward, and we're going to kickstand the hands into the ground. Then what we're going to do is we're going to hold this position in external rotation of the lead leg for 1 to 2 minutes. Our trail leg will be holding an internal rotation. Our lead leg will be an external rotation. We're going to now focus on what is called PALS and RALS, and that means progressive angular isometric load and regressive angular isometric load. The progressive angular isometric load in this circumstance, in external rotation of the lead hip, is pressing or pushing into the ground further. So that would be the progressive angle. We'll take this position and this posture for upwards to 2 minutes passively before going into our progressive or our push. After progressively going from 0 to 100%, we're going to use the regressive angular isometric load, or we're going to use the tissue on the opposite side of the leg, so the inside of the leg. And we're going to actively try to internally rotate the leg off the ground or pull the leg back. Okay, so we're going to passively hold this for 1 to 2 minutes. Then we'll begin our RALS effort, which will be to press the lead leg or push the lead leg into the ground and press the whole body down into the ground from 0 to 100%, 5, 10, 20, 30, 40, 50, 60, 70, 80, 90, okay, 100, hold here, nice and strong, upwards to 10 seconds, and then your regressive angular isometric load will be to pull that leg off the ground and push into the ground as much as you can, high as you can, upwards to 10 seconds, and slowly relax that leg down. For the trail leg, for your PALS and RALS, you're in internal rotation of the back hip, or the back hip here. So we're going to press the knee down actively in internal rotation, 0 to 100%. We're at 100% here. And then your regressive angular isometric load here, just try to get everything up. And then knee down, foot up off the ground, as high as it'll go. As high as it'll go, 2 and 1 and down. And then from here, I want you to straighten out that lead leg and open up and hinge the trail knee. Hinge and open up. Hinge and open up, and then I want you to just straighten out your legs just like this. Shake them out. So you just completed some external and internal rotation, pals and rails. You also did some butterfly and bear sit, and I hope you learned some good hip mobility exercises that you can start incorporating into your mobility routine. Thanks a lot, everybody.